presenting a concept analysis on compassion fatigue by Amanda Billingsley, Holly Knapp, Jennifer Navarre, and Jamie Sleeper. I am Jamie Sleeper, and I will be discussing background and significance, meaning in published works, and the purpose of the concept analysis. Compassion fatigue began as an offshoot of burnout about 20 years ago and encompasses all areas of clinical nursing as well as other professional fields. However, for the sake of this presentation, we're going to focus on compassion fatigue in nursing. The nursing profession is characterized as caring, compassionate, stimulating, and rewarding. An increase in demands and complexity in the healthcare environment causes nurses to be at risk for occupational stress and adverse psychological effects. Nurses working in intensive care, pediatrics, oncology, and mental health have been found to be particularly susceptible to compassion fatigue. This concept is significant to nursing as chronic exposure to pain, suffering, and trauma, combined with identified personality traits inherent in being a nurse, make the nurse susceptible to compassion fatigue. Health agencies, national organizations, and nurses alike are increasingly recognizing it as a significant negative effect on the nurse's well-being. Many programs promoting nursing self-care have been implemented as a result of compassion fatigue research. Several nursing, psychological, and sociological theories have proven that being a nurse can produce adverse psychological effects. Adams, Boscarino, and Figley discuss the meaning of compassion fatigue as the caregiver's reduced interest or capacity to be empathetic or to bear the suffering of clients. Their study conceptualized compassion fatigue within a stress process framework and contended that challenging environments or stressors require physiological and psychological responses from individuals. Vallant postulated that compassion fatigue occurs as a result of unsuccessful or maladaptive survival strategies. Sobo discussed the meaning of compassion fatigue as severe malaise resulting from caring for patients experiencing physical, emotional, and social types of pain. Finally, Boyle designated compassion fatigue as a progressive state of emotional unease, where compassion energy expended by nurses exceeds the ability to recover, resulting in significant negative psychological and physical consequences. The purpose of conducting a concept analysis is to analyze a basic concept and its elements to help differentiate one concept from another of similar meaning. The purpose of this concept analysis is to examine compassion fatigue in nursing with the intention to better understand, identify, prevent, and treat compassion fatigue in nurses.
I'm Holly Knapp, and I'm going to be discussing definitions, defining attributes, and theoretical definition of compassion fatigue. Compassion is the awareness of another person's distress and possessing the desire to alleviate their discomfort. Fatigue is a state of extreme weariness or tiredness. Empathy is the ability to understand and feel emotions related to another person's feelings or experiences. Burnout is a condition of physical and emotional fatigue resulting from prolonged exposure to stresses of a difficult job. And stress is mental tension, anxiety, or worry. The defining attributes of compassion fatigue have physical effects, emotional effects, social effects, spiritual effects, and intellectual effects. The physical effects are decreased energy, burnout, being accident-prone, persistent physical ailments, sleep interruptions, frequent headaches, and stomach aches. Emotional effects are apathy, sadness, decreased motivation, fear, and helplessness. Social effects are isolation, indifference, callousness, and avoidance. Spiritual effects are poor judgment, disinterest, and introspection. Intellectual effects are disorganization, forgetfulness, short attention span, and confusion. The theoretical definition of compassion fatigue. Compassion fatigue is the end result of prolonged exposure to stress experienced by nurses. It's a cumulative progressive process that evolves over time. It begins with compassion discomfort, leading to compassion stress, and eventually compassion fatigue, if not alleviated with rest and decreased exposure. It is the outcome of compassionate energy expenditure which exceeds the nurse's recovery and restorative abilities. It is manifested by intellectual, spiritual, emotional, social, and physical changes that are increasingly severe with each progression process.
I'm Amanda Billingsley, and I will be reviewing the 5 cases: model, related, borderline, contrary, and invented. The model case, according to Walker and Advent, gives the best possible example of the concept based on its definition and related terms. Erin is an RN who has worked on the pediatric oncology floor of a children's hospital for 6 years. She has served as the team leader for the past 3 years. Erin works with children of different ages who have cancer of varying degrees. She administers chemotherapy and other therapies to young patients. In addition to caring for sick children, she also supports the families. Erin has cried many tears with family members over the loss of a child. The 20-bed oncology unit is always busy and often short-staffed. Erin has many additional duties as the team leader, which adds to her stress level. She has prolonged exposure in this stressful environment as she has worked full-time for 6 years. At first, Erin loved her job. She would spend much of her time getting to know the children and their families. But lately, she's not been herself. Some of Erin's co-workers have pointed out a change in her demeanor. They ask what's wrong, but she responds that she's just tired and needs a vacation. But things continue to progress. She begins showing up to work a few minutes late, using her sick days more often, and is noticeably more irritable with everyone. She's not seen playing with the children anymore or spending time talking with the families. She's doing her job, but just not with the same energy and joy. Her coworkers notice that she's not taking the sickest patients anymore, opting instead for the lower acuity ones. Eventually, Erin even notices the changes in herself. She feels completely drained of every ounce of physical, emotional, spiritual, intellectual, and even psychological energy. She has nothing left to give. Erin is suffering from compassion fatigue. The next case is called a related case. Related cases are much like the model case with some differences. The concept we will use as the related case is burnout because of its similarities and differences. Karen is an RN who works for a home health agency in her local community. She's worked there for 5 years and mostly has enjoyed her work. She obtains much reward from her work, helping people recover from their illnesses in their home. Her schedule has always been busy and her caseload full, but things have changed over the past couple of years due to decreased resources and some changes in management. Her workload has increased and due to decreased staff. She gets home late at night, past 9 p.m., and then she has to stay up all night doing paperwork. She's on call most weekends. She's responsible for training the new staff, all while working for a nurse manager with no management experience. Karen's family is the first to notice the changes in her demeanor, as she is very irritable and easily angered and obviously very tired. Her patients notice she is more withdrawn and negative, often responding with sarcastic comments. Her coworkers would rather not work with her anymore. Karen is unfortunately suffering from burnout. The next type of case is borderline, which according to Chin and Kramer is more of a metaphorical analysis of the concept. We're using the concept in a different situation. Compassion fatigue is explored metaphorically in order to understand its true meaning. The word compassion is familiar to most of us and synonymous with words like empathy, love, mercy, and kindness. Most people believe a mother embodies the word compassion. The word fatigue is a familiar term and synonymous with sleepy and tired, exhausted, and weary. A phrase, drunk with fatigue, is familiar to many of us, but we may not realize where it came from. It came from a poem written by Wilfred Owen during World War I about the perils of the soldier in the war. It refers to, or perhaps implies, the soldiers are so tired that they've lost their sense of good judgment, balance, coordination, muscle tone, ability to focus and make good decisions. If we combine these two thoughts, one may envision a mother rising in the middle of the night yet again to nurse her crying infant. She is so tired it hurts, perhaps even drunk with fatigue, as the poem suggests. But compassion pushes her on. No pain or amount of fatigue will keep her from her crying child. But without proper self-care, she will suffer illness herself. Another case is the contrary case, which is not an example of the concept at all. It is very different from the concept. Compassion satisfaction is the one that we will describe, and it is described also by Neville and Cole as the opposite of compassion fatigue, as well as the goal of recovery. Abby works as an RN on a CVICU unit and enjoys her work. It is a 20-bed, high-paced, high-stress unit. Often they are short-staffed and have to stay late. She works 12-hour shifts 3 to 4 days a week and is exhausted when she leaves. But she looks forward to coming back for her next shift. She receives such reward and joy from caring for people and seeing them improve. She spends time listening to her patients and families, getting to know them and giving of herself. Abby is a spiritual person and feels a deep sense of purpose and satisfaction when she's serving others. She rejoices when the patients feel better, and she cries with them when the prognosis is poor. She gets physically tired and is in need of rest, but never grows tired of serving others. She loves her job. Abby is joyfully experiencing compassion and satisfaction. The last case is the invented case. And according to Walker and Abbott, the invented case are made-up cases and many times involve science fiction ideas. And they're used to more clearly describe the concept of compassion fatigue. A horrible disease broke out on planet Mojawapo and it spread quickly. Princess Rama from planet Zohali was attending a royal symposium on the planet when the outbreak occurred. It soon became clear that she was immune to the disease because she was the only one that was not affected. The princess was filled with compassion and wanted to help all of the sick. She summoned for assistance from her planet Zohali. Upon arrival, the Zohalians initiated a plan involving teams and shift work to provide recovery for the workers. Princess Rama was encouraged to go home and get some rest, but she refused. She spent much time with the ill, feeling their intense loss. After a year, her father, King Fahari, came back to bring her home. When he arrived, he barely recognized her. She seemed sad, tired, and distant. He hugged her and told her she's helped so many people and saved so many lives. But she callously remarked, "I don't even care, let's just go." Sadly, Princess Rama was suffering from compassion fatigue.
Now I'm going to discuss the antecedents and consequences of compassion fatigue. The antecedents are the risk factors and causes associated with compassion fatigue. The prolonged, continuous, and intense contact, use of self, and stress. Consequences are high absenteeism, constant changes in coworker relationships, inability for teams to work well together, desire among staff members to break company rules, outbreaks of aggressive behavior among staff, inability of staff to complete assignments and tasks, inability of staff to respect and meet deadlines, lack of flexibility among staff members, negativism towards management, strong reluctance towards change, inability of staff to believe improvement is possible, and lack of vision for the future.